What is the problem with this one? Avarana is one of the condition related to the Vata. Vata is only the dosha which create Avarana and itself becomes Avarana or make other things to be Avarana. By the Kapha, if it is in the normal condition also, Prakupita Vata make it Avarana. Kapha Avarana by the Vata. Same condition, it covers Vata becomes Avarana by Kapha. Kapha cover it. These two conditions can occur. This thing related with the all doshas. All doshas means Vata, Pitta, Kapha. Vata becomes Avarana by the other Vata. What is Avarana? Avarana is nothing but the Pratihata Gati. Main thing is Pratihata Gati. Obstruction or partial disturbance in the movements. Okay. And this is the, oh, I am having a report. So what I will do is, this make the disturbance, not the fan. No. The low temperature of it makes moist mist. Avarana is a condition related to the main Vata and it can be happen along with the other doshas. In the same time, Vata Avarana, Anyonya Avarana. This is known as Anyonya Avarana. This condition. Second one. Third one, the dhatus may become Avarana or make Avarana for the Vata. This condition also occurs. Generally, this told in the Vata Rakta. In the Vata Rakta, Vata and Rakta both becomes Avrita. Here, no, it may. I will become. And by the Rakta itself, Rakta Marga Avarana or Raktena Avarana Vata will happen. Here in the Dhatus, the Dushti of Dhatu and Srotas are the same, considered as the same. Yes, Adam. Oh, take that. No, close the door. Generally, Avarana considered as very tough one and not understandable. If you think about the physiology, then you can understand it very well. In the physiology, Srotas is having a great importance in the development of the disease. What is the Srotas? That is the Manat Dhamanya. Dhamanya are the Srotas. They are filled by something. Saranat Sira, something is flowing in that one. And Chitrani, wherever the space is there, all are Srotas. So, these places related to the Vata. The movements, filling or the vacuums, all are related to the Vata. And Vata is having the function of the movements over here in the Sira, Dhamani or the Chidrani, Srotas, whatever may be that. And Sroto Dushti is told according to the Dhatu. Function of the Srotas disturbed by the disturbed as Sroto Sangha, Vimarga Gamana, Sira Granthi and Sangha, Vimarga Gamana and Ati Pravritti. Sangha, Ati Pravritti, Vimarga Gamana and Sira Granthi. All are related with the Srotas function. But in the Lakshanas, it is related with the Dhatu. Dhatu Dushti by the Vata Pitta Kapha. So, these Srotas function and the Dushti Lakshana is told according to the Dhatus. So, in the Srotas, the function of the Vata is very important, and whenever the Vata is Prakopa, related Srotas and related Dhatu or Mala becomes Dushti Lakshana. And Avarana makes suppressing or covering of the main functions or the symptoms. Kapha having Stimita, Gaurava, all of these, Snigdha, Pichila. When Kapha is getting Avarana by the Vata, Vata is covered the Kapha, then Vata Lakshana will be prominent. Kapha Lakshana are masked. This is covering. And what is the total effect of Avarana? That is Pratyata Gati. The movements are stopped or suppressed, slower and covered. These are the condition of Avarana. Are you clear this?
Yes.
Otherwise, whenever you consider this Avarana point, you will confuse.
Not clear for me, sir.
Okay. Very simple thing. Avarana means coverage. Okay.
Yes.
One Prakupita Kapha makes some symptoms. We can identify. If it is covered by the Vata, then Kapha symptoms are lesser. Vata symptoms will be more. This is covered. Now, Rakta is flowing in its dhamani. Now, it is stopped because of a thrombosis. Now, what happened? It is covered. Stopped. The movement is stopped. This is Avarana. And arteries becoming sclerosed. Now, blood cannot flow freely. What happened? This is Avarana.
So whenever there's obstruction, it's Avarana?
Correct. Obstruction, partial or total. That is Avarana. Okay? Any doubt? You clear this one. Otherwise, further points is difficult to understand. This Avarana comes everywhere. Agni Avarana. The function of the Agni is covered or depressed, suppressed. Avarana of Rakta is very common. Avarana in the Rasa, common. Avarana of the Srotasas, this is that. Everywhere the Vata is important. So in the Vata getting Prakopa, two conditions. One is Dhatu Kshaya, other one is Avarana. By Avarana, Vata becomes very powerful, very Krodhata. It may be normal in quantity. Vata is assessed by quantity and functionally. Shaktena, Vasturupena, both are there. So, in this condition, Vata becomes more Prakopa. Prakopa makes in the Srotas, Vimarga Gamana, Sangha, Ati Pravritti. Here, Prakupita Vata makes any of the function disturbed. It may be Ati Pravritti, it may be obstructed, or it may be different route traveling. This may occur. Pratihati Gatatvat. Avarana. This is common Avarana. This occurs everywhere. But in some conditions, Avarana is having its own importance, which is considered as the first of the treatment. So, Avarana Vyadhis are told. There are number of Avaranas. Typical Avaranas told in the Charaka, I think 13 types are there, I think. In the Vata Vidhi is told. Just weapon. In other diseases also, wherever the pathological condition develops, it means Avarana. So, what is important in the treatment? That is Avarana Nivarana. We should remove the Avarana. The different methods are there. One of them is Sneyana Svedana in Vatvyadhi. When the Shakha, Shrita, doshas are there, by the Svedana, Vata becomes normal or Prakrita. Svedana, Sroto Mukha open. Srotas are movements. That's Avarana is removed, so it will go. Vishyanath, Vriddhitva, they are make the doshas come to the koshta. Same way, in the even though Snehana Svedana is Pura Karma, it is the treatment for Vata. Why? Because of the Srota Shuddhi and Ushna Guna opposite to the Vata. So Vata, due to the opposite Guna, Vata becomes Anulomana, Srota Shuddhi, Srota Visparana, so Vata get all the doshas to the koshta. Then treatment is easier. This is the understanding of the treatment is important here. Whatever the treatment we do, we become success. But sometimes we cannot interpret it why this is happened. But generally, all the treatments are told or considered along with the pathogenesis and the pathological factors. So, the specific treatment is told in every disease. In Jwara Chikitsa, methodic treatment is there. Rakta Pitta, Vimarga Gamana, Vimarga Harana. And Grahani, Agni Deepana, Avayo Balakarana, Radhekshma, Dhatu Poshana, Sroto Shuddhi. This different in Udara, Ambua Sroto Shuddhi. That is important. So these specific treatment sutras are told related to pathology and pathogenesis, particularly the srotas. All the treatments affect in this one. And whatever the drugs you select, that also having the different effect on the Samprapti Ghatakas makes Sroto Shuddhi or Avarana Nivarana. Without Avarana, there is no disease. But you can tell, still there are so many diseases. Vruddhi and Kshaya makes the disease of the doshas. But maximum in the combinations makes Avarana. So even in the Sannipata condition of the dosha, in the Jvara, they mix together and sometimes it makes Avarana of the Vata or Vata makes Avarana becomes very serious. In Sannipata Jvara, when becomes Dhatu Gatatva, then also the Vata, if makes Avarana, the condition worsens. So Avarana should be cleared. Sometimes it is important, in some conditions Avarana is not so important. So important some disease we'll discuss. And there are some
What is causing Avarana?
yeah, very good. See, Avarana may occur by the Guru Abhishanti dosha. Rajakshma, Guruni Abhishanti dosha, Kapha and Ama. This makes Avarana in the Srotas. So Sroto Dushti and Dhata Pushti is lesser. So due to the Avarana and Dhatu Kshaya, Vata becomes Prakopa. Shosha is definitely. This is one condition. Another one, Vimargagami Vata itself. Vata becoming in a reverse direction. So it suppresses the normal Gati of the Vata. Gati is related to the Vata. So that makes Avarana or obstruction in their movements. So Guru, Abhishyandi, Sthiradi Guna and Vatasya Gati. Gati itself makes Avarana. Okay? Any doubt? Generally this needs thinking more. If possible, try to read the Chakrapani Tika of the Vatvyadhi. It is written. The simple sutra. Vata Prakopa, only two karana. One is Dhatu Kshaya or Riktata. Other one is Avarana. Only two. This is very potent Nidana. Other Nidanas are related with the subsequent things. After the other Nidanas, the two conditions will occur for Vata Prakopa. One is Avarana or in the Kshaya, Dhatu Kshaya. In the Avarana, it may be related with any other doshas. Why Agni is taken to the body? It is in the Vimarga Gamana. By the Avarana of Ama. Ama Avarana and it stops its movement, regular movement, and Agni also becomes Avarana. So whatever may be the Agni is there, it is travelled to throughout the body, makes Jvara. That is related with the Vimarga Gamana of the Vata in the Vimarga Gamana of the Rasavasrotas. And the same Avarana of the Agni and the Avarana in the Svedava Rasavasrotas. So they becomes jam. It will stick that. Here the doshas are related to the Ama. Ama, Pichila, Guru, Abhishanti. This may occur in any srotas. Cholesterol, Ama, Pichila, that is Ama related with that. Blood clots related with the dosha, other Rakta dosha. Clots we can consider. This is interpretation, but the thing is the same. Okay?
Sir, how we can recognize the Aavran or like dosha vishesh in the practical sense? We will discuss
Clinical
it later.
conditions.
See, in the patient, no, we can put on the fan. Practically, we assess the disease in two ways. This is told in the Kushta Adhikara, Kushta Chikitsa. We determine the diagnosis of the Kushta by the Lakshanas. Lakshanas, we understand this disease Kakanaka. Here, next act, we study the book. Here we know. So we correlate that and then we will assess the Samprapti Ghataka. This is the way to assess in the practical clinic. By the symptoms, interrogation and examination, we think what is the pathological condition. Not only the symptom. Then we think possible diseases. Possible diseases, then comparatively one disease will be more prominent or two diseases may be there. Then we will think the pathology of the disease. Again we correlate. Next, we decide the treatment. According to the pathogens and the pathology, this type of treatment is needed. That is the way, practically.
Because according to so many different diseases of Avrana, it's overlapped so many diseases.
Yeah.
Like some cause Pranavaha Prana Avrana cause Hrud Roga. So there is Hrud Roga separately also according to 5 types. So like example I'm saying, like Prameha is maybe Kapha or Vata or Pitta, then Avran also may be there. After that one, like
The Prameya we will discuss little more. Injection Rudroga it is there. Rudroga in the Upadra also it is told. In the Upadra complications occur. He is giving the reference here Vatvyadhi mainly, not other disease. All the diseases generally having the Aavran in different conditions. So whenever there is Avarana, we make Sroto Shuddhi Karaka. One is Vishandahara, Anuloma Karaka and Virechana.
okay.
So Virechana in so many conditions helps. Generally we think as Malashuddhi. It is not only Malashuddhi, it is Sroto Shuddhi Karaka. So Nitya Virechana or timely we give Mrudu Virechana. Mrudu Virechana also for the treatment of Vata. So we control the Vata. Vata is one of the main important role in all the disease and pathology. Otherwise, disease will not develop. The cause of this development is related to the Dhatu and Dusha Samurchana by Vata. Vata is needed. Vata will be there. So it is known as Vibhu, God. In the starting section, all the pariyas having its own importance in the diseases. In the starting I have told Vibhu, Vishwa. Just I will read. They are important. They all are related to the disease told in the Charaka. Sarvartha anartha karne. Sarvartha means whatever we need, we can gain. We can gain. Anartha karne, destroying. Vishwasya eka karanam. All the universe, only one reason. Adushta adushta bhavanaha. Normal in the universe, the normal maintenance of the universe or vanishing the universe is mainly related with the pavana vata. Dushta adushta. Dushta pavana destroys. Adushta pavana makes normal. See, there is the rain or cyclone. All are related to the air, vata. Same way, in the soil, everywhere vata is important. Pavana. Sharirasya cha visheshata. This is special in the body. Sa Vishwakarma. Vishwakarma is creator. Everything is developing. He can make new things. That is Vishwakarma. Vishwatma. This is in the center of the Vishwa. Just our soul in our body, the soul of the universe. That is Vata. Vishwarupa. There are different appearances of that one. We cannot count. That is Prajapati. Just like a Brahma, creator and maintain. Srishta. He can create anything. Dhata. He can give or oblige so many things. Vibhu. He is the Lord. Vishnu. Just like Vishnu. And Samvarta. Just like Lord Shiva. He can collapse everything. Mrityurantaka. He is the Yama or the god of death. Antaka. He is the destroyer, making death. These names are why given. This is the same things what happening in the body, along the disease or in the health. Tat dushta dushtau prayatnena yativyatah matha sada. So always keep concentration on the vata. Make it adushta. Let it not become prakopa. Tasyoktam dosha vijnane karma prakrita vaikritam. Dosha vijnani adhyaya in the sutra sthane. There it is, prakrita and vikrita karmas are told. Just refer. Samasahyato dosha vediye nama dhamata. All the places of the vata and name are given in that one. Pratyekam panchada charo vyaparascha. There are 5 types of vata and their movements and their functions told in the Sutra Sthana. that is telling. In the Chikitsasani referring that one. So this idea we should have. What is Vata? First, I told just in introduction about the Vata. What is Vata? In the first lecture I think told. Along with that one, he is telling the Paryayas and is comparing how this is affecting the body. So that is Vata. Okay, are you now clear?
Yes, sir, but you said also ama can be there. Then if we give for example snehana, it's not good, no, if ama condition
Yeah,
is
the
there.
same thing. If ama is there, it is pichila and making obstruction in everywhere. It is making Aavran of the other things, ama. So, Vata also will become vitiated or become Prakopa with the ama also. So, now Vata is not Prakopita, ama is making cover. So, first we should make ama should be clear. Ama is having Pachana, Shodhana, more treatment is there. So, Svedana, Kala, Yavagu, Tiktarasa, all are related with the ama. Ama is becomes digested, and Svedana also makes digestion of the ama. So Vata will be open, then Vata will become Shanta and Ananomagati. So ama treatment is first whenever there is ama. Without ama clearing, we cannot reach to the doshas. First, whatever the treatment we do, first go to the ama. Second step, go to the dosha. Next, go to the dhatu. There is step-by-step treatment. In the Jwaratic site, this is detailed. This is the general method of treatment. Okay?
Yeah.
This is not only ama, Pitta also make Avarana of the Vata. Dhatu make Avarana. Purisha, Mutradi makes Avarana of the Vata. Then Vata Shuladi will develop. Everywhere it is there. Avarana is one of the conditions in the pathology. We cannot neglect it. Generally, we do Avarana Chikitsa unknowingly. Without knowing also Avarana we do the treatment. Because according to the method we are doing, the medicines we are selecting according to the disease. The same thing. Lakshanat Vyadhi Jnanat Samprapti Jnana. That we are developing. So, in so many years of practice, you understand so many things, but you cannot express. This is there. Tribhuvan Kirti generally we give. In all Jora, Swata, Kapha Jora, we give. Gets result. Compounder also gives the result. The difference is you can explain by studying the medicine and Samprapti of the disease. But compounder cannot. That is the difference. And you can give it in other conditions according to the Samprapti. But other person cannot give. So you are compelled to study, you feel as non-use. Generally in my study, Vimanasthana, all are getting bored. Even the first MD, they are also teaching one of the great professor, Vijay Thakur. He was the teacher to teach us, and we were always getting bored and sleeping. And when I come to the lecture post, then I understood the importance. Student will ask me, sir, what is the reason, what is the importance, what is the avarna, what is the condition of the pathogen? These things I should explain. So for that I am referring, then I become clear about the points. So you don't get bored, try to study, repeatedly understand, try to explain the doubts, clear, then you will understand more. That is known as Adhyayana.
Which other references are there
For?
in Samhitas?
See, for starting, see, very simple, starting, very handbook, very easy, that is Sharangadhara. Just read the Sharangadhara for your knowledge. That is the best thing, very simply told. Next study, Ashtanga Hridaya. Very simple language with a very good translations will be there. Next, go for Charaka, Sushruta. Shruta is little difficult and more elaborations. Then go Jaraka with the Chakrapani. Then you can understand it, Charaka. And then again with some knowledge, study Bhava Prakasha.
Okay.
And he is a consultant, and different meanings and explanations given for the Charaka and Sushruta. In Bhava Prakasha it is excellent. Then see Chakradatta. He is also one of the great physicians. and Yogaratnakara, first Rasa Chikitsaka, that is Yogaratnakara. By these books, first this way, then again Yogaratnakara and Ashtanga there. Sorry, Yogaratnakara and Bhav Prakash. Study this one. Next, lastly read Vaishyaja Ratnavali. You can find so many medicines are there. According to that, he simply gave the guidance, the disease, Samprapti and the medicines. Given elaborated medicines. Which medicine can be single drugs, combination, Krita, Taila, Basma, Kopi Pakwa, all he told. Usage different medicine. By that only can become a physician. And some guide the person should be there, guide should be there.
Yes.
Otherwise we will misguide. This is the importance of PG. So actually in the PG, you have to study laboriously. There is no time to see a movie. Sometimes due to the age and chance of that we miss the time. But whenever find, and the importance comes in the teaching life. Teaching life we should have correct elaborations. We cannot skip in front of the students. So for that again you have to study. Okay? So Aavran is very simple. It is covering or become cover. The functions are listed, okay? There are Avarana Upadrava is told in the books. There are the complications in the other diseases, particularly related to the Avarana. And therefore, Anyonya Avarana, Avarana, Vatavarana, Dhatu Avarana, all are there. There are just examples. And there are so many other Avaranas also there. Rudroga, heart disease may develop. Rudroga, Marma Bigata. According to Ayurveda, Hridaya is having the role along with the Marma and Rasava Srotomula. Two things are there. Rasadatu Dushti, Lakshana may develop because of the Srotomula. And Marma Vigata Lakshana may be there. And it is the place of Ojas. Ojas are two. Stula Ojas, Sukshma Ojas. The place of Sukshma Ojas is in the heart. So, Marma Vigata, Ojo Nasha and Rasava Sroto Dushti. These are related to the Hridroga. And Avarana is one of the condition makes Hridroga. Vidradhi, abscess. Pliha, Gulma, Atisara, Evacha. These are the complications related with the Avarana. Bhavanti Upadravastesham Avrutam Anupacharet. If you are not taking Avarana, then these complications may develop. This is Paratantra condition, disease condition related with the Avarana. Okay, next we go for the disease. Are you clear this? Shloka, this is so Tantra. Shloka indicates so many meanings. Oh, Vayu Sukshmatvat. It is having so many capacity to penetrate small areas. Srotas having chitra, very small chitras, very small vessels. All Vata can move. And Vayo Tatra api Udirana. It makes Prakopa other dosha. So, Kupita Tau Samudhoya by Sukshmatvat, it enters any place, and Udirana character, it makes Prakopa of other doshas or mala. And Tatra Kshipan Gadan, and it takes other places to the body, or here itself, or itself becomes Avarana. This is the reason. Sukshmatvat, Udirana Gunatvat becomes Avarana or makes Avarana. Karoti Avrata Margatvat Rasadincha Upashoshaye. And due to the Marga Avarana, once happens, then Rasa or the related Dhatu become Shosha. Kshina, Dhatu Kshina may develop. As you seen in the Rajekshma Samprapti. Okay? Are you clear? See, there's nothing. When this type of Vata becomes Prakopa, it makes Marga Avarana. it makes some Rakta Avarana, then Raktava Srota Dushti will, Rakta Dhatu Dushti will be there. But next Rakta Mamsa, Mamsa Shosha will develop. Rasadinta Sosha, from the Rasa Shosha itself it starts. Avarana, from the, in the Jara, Rasa Avarana will be there. Rasa was Veda. Okay? Do you feel tough? First lecture. My language is a little different. Okay. Are you clear?